7 signs of cardiovascular disease that you can see with the naked eye. Number 1, clubbing of the fingers, so widening of the fingers at the fingernails, is associated with mainly cyanotic congenital heart disease and some other chronic cardiovascular pulmonary conditions. It indicates low blood oxygen and vascular changes. And this correlation is strong in congenital cyanotic heart disease, but less strong in general adult cardiovascular disease. So that's for clubbing of the fingers. Number 2, that crease, the deep crease you see in the earlobe, Frank's sign it's called. This diagonal earlobe crease has been consistently linked with coronary artery disease. And a meta-analysis show individuals with this crease have a 3.3 times higher risk of coronary artery disease and increased stroke risk. However, despite the statistical association, the use as a diagnostic tool is modest and you wouldn't want to depend on it alone. 3, distended veins, which could include varicose veins, but distended or varicose veins are linked with inefficient venous return and chronic venous insufficiency. These conditions can increase cardiac workload and over time potentially contributing to heart failure, especially with a coexisting risk factor, so not on its own. Correlation is moderate, but emphasizing venous disease rather than in cause to other aspects of cardiovascular disease. 4, this is a big one, erectile dysfunction. ED is a strong early marker of cardiovascular disease. Men with ED have nearly double the risk for cardiovascular disease compared to those without. And studies indicate that ED correlates with future cardiovascular events, including heart attacks and strokes, with an inverse correlation between ED severity. So the worse the ED is, the worse the cardiovascular health score will be. 5, shortness of breath. Shortness of breath is a common symptom indicating underlying cardiovascular conditions like heart failure and ischemic heart disease. So shortness of breath can predict significantly higher long-term risk of heart attack, heart failure, and stroke. And those with severe shortness of breath have more than twice the risk of heart attack compared to those with no symptoms for shortness of breath. Additional signs, this could be with weaker or secondary correlations. So that's something else to consider, is the shortness of breath. Number 6 of 7, water retention in your ankles. So this is peripheral edema. It often indicates heart failure or venous insufficiency as well, and it could result from poor cardiac pumping or venous return. This is strongly correlated with congestive heart failure development, and prognosis is you need to get that addressed if there's issues with water retention. And lastly, increased pigmentation in your shins, hyperpigmentation. This is commonly caused by venous insufficiency, that your veins are not draining properly, and from chronic stasis, so the blood not draining out. You see it a lot in diabetics. The correlation is moderate, but it does indicate a prolonged burden on the venous system. So in summary, erectile dysfunction and shortness of breath, they have the strongest correlation to cardiovascular disease, while finger clubbing, the earlobe crease show moderate associations, and distended veins and skin changes as a more indirect signs that could be signs of poor venous return rather than primary markers. So these are all 7 things that you can see on your own with the naked eye. So be aware. You can be looking at your friends and family and analyze them. You'd be like Dr. House.